Doctor, you mentioned getting an ECG done. Apart from the ECG, are there any other tests or precautions that should be taken so that the child can be safe?
Absolutely. An ECG should be done, but along with that, those who have diabetes should take precautions, get their sugar levels checked, and keep their sugar under control. If your blood pressure is high, get it checked, take your blood pressure medication regularly, and keep your blood pressure under control. There are different types of blood pressure medicines, so always consult your doctor before taking any medication. There are many medicines that control blood pressure but do not protect the heart, and some medicines can even cause problems like diabetes. Depending on age, environment, and the individual patient, different types of medicines may be needed, and only an expert doctor can explain this to you. So consult your nearest expert doctor, keep your blood pressure under control, keep your sugar under control, and definitely manage your cholesterol. If you have high blood pressure or diabetes, make sure to get your cholesterol checked once every 6 months. Otherwise, at least get your sugar and cholesterol checked every year or two. High cholesterol also has a negative impact on the heart, and the most important thing that is in your control is to quit smoking. If you smoke, then cease the act of smoking, because the natural progression of increasing age, being of the male gender, the detrimental habit of smoking, elevated levels of cholesterol, a family history of cardiovascular disease, persistently elevated blood pressure, and uncontrolled high blood sugar levels are all significant and well-established contributors that substantially increase the likelihood of experiencing a heart attack. Along with this, for vegetarians, elevated homocysteine levels are also a factor that helps cholesterol accumulate in the blood vessels. So this should also be kept in mind. There are some medications for this, as well as some multivitamins, B-complex vitamins like B12 and folic acid, which should be taken regularly. That's why I urge you not to take the pandemic of heart disease spreading after COVID or COVID itself lightly. Take care of your health, consult your nearby doctor, and get yourself properly checked. Make the necessary changes in your lifestyle. If you are overweight, lose weight, and make sure to do some regular exercise. I would like to mention one small thing about exercise. There is no need to become obsessed with it. Do exercise in moderation, but remember that exercise alone cannot solve everything. Sometimes, if your heart has been affected after COVID, rest is also important. This is a very important point. So, exercise in moderation and take rest when your body needs it. Quit smoking, control your weight, keep your blood sugar and blood pressure in check, get your cholesterol tested, and keep your cholesterol under control. I would like to mention one more small thing. For the past several years, there has been a continuous propaganda on WhatsApp University that cholesterol is not harmful. Number one. Number two, there is a statement that it is harmful and that doctors, in collusion with companies, are making people take statins for their own benefit. There is no benefit to this. These two things that have spread, I want to tell you that we have had heart attack patients, even those under 80 years old, and we managed to control their cholesterol well. In such cases, we brought their total cholesterol down to below 100. We reduced their LDL cholesterol to below 80 and then even below 60. We increased their HDL cholesterol to above 45 and reduced their triglycerides to below 100. Even in such patients, despite having a heart attack at the age of 80, they did not have another heart attack for 10, 12, even 15 years. I'm saying this because if at the age of 80, you can live for 12 or 15 more years just by controlling your blood pressure and cholesterol, what more could you ask for? So don't be misled into thinking that cholesterol doesn't cause any harm. Cholesterol is very harmful. It accumulates in the arteries, blocks them, and causes major heart attacks. And if you need to take statins to control it, you absolutely should not hesitate. Every medicine has some side effects. Even water and air can cause harm, but with caution, under a doctor's advice and with proper consultation. If you keep getting the recommended tests done from time to time while taking the medication, your health will improve. Take care of yourself, stay alert, stay healthy. Thank you.